We're back now at 8:11, and this morning on Today's Health, the vulnerable male. It's a universal fact that men die before women. But why has been a mystery. That question is explored in Dr. Marianne Legato's new book, Why Men Die First, in which she explains the important biological differences between the sexes. And Dr. Legato joins us now, along with NBC's chief medical editor, Dr. Nancy Snyderman. Doctors, ladies, good morning to both of you.
Good morning.
I have to say that while I think every man and woman should read this book, it's very depressing for men. Some of the stuff in here makes you think like feel as though we have the deck stacked against us from the very beginning.
Well, you do in a sense, which is why we'd like to take better care of you and focus our research differently. We have not paid enough of the right kind of attention to men's health issues.
This begins at conception, Nancy. Yeah. I mean, basically, as soon as the male is conceived, the deck, as I said, is stacked against him.
Marianne writes very eloquently that even in the womb, the male fetus is more at risk for infection, more vulnerable to disease.
That's right.
And you survive in spite of it. And I've sort of laughed with her over the years. You rule the world in spite of it. So it somehow
by the time they make it.
By the time they make it, that's right.
Well, let's say that if we're lucky enough to actually make it through the pregnancy and be born, in the early stages of life, men are also, I think, 3 times more likely than women to die in the age group. I think it's in the early 20s, isn't it?
Yes.
So why?
The deck is stacked against you, sadly. There are some biological differences. When you're born, you're 6 weeks behind girls in terms of development and readiness for life. Even as a child, you absorb iron less efficiently. And then comes the adolescent period, which is really risky for young men because of the combination of floods of testosterone, which is the hormone that prompts people to take risks, be very ideal, passionate. But the centers of the brain, unfortunately, that have to do with judgment and deliberation and decision-making are not so well.
So that combination of taking risks and having bad judgment is a very dangerous combination.
Somebody described it as a Porsche without brakes.
Take me further into life. Okay, now we get into middle age. What do we define middle age as these days?
I'd say 40-ish.
Okay, 40-ish, and even into our early 50s. Now we start to look at things in men that we don't see that early in women, in particular in the area of heart disease.
Yeah. Right.
That's the one that really looms. And the classic, male chest pain, an elephant sitting on one's chest, pain radiating down the arm. But men are vulnerable because high cholesterol levels, high stress levels, and I would argue a reluctance to sort of turn on their intuitive selves to say, ooh, I wonder if something's wrong. Well, this push through the pain kind of concept in society.
We train them to suck it up.
Yeah.
Well, and how dangerous is that? I mean, women do tend to be more in tune to their bodies than men are, and that can have catastrophic results.
Men, in fact, are very tuned, but they deny that they're ill. They resist saying they need help. And they are trained to sort of push ahead no matter what the issue is.
Because society doesn't reward them if they're seen as weak.
That's right.
Yeah. If we have these inherent vulnerabilities, what about, do we have also some inherent strengths that give us an advantage?
Well, you have more muscle power, for sure, heavier bones. You're much less likely to have osteoporosis, although 1/4 of cases of older people with osteoporosis are men. And I think that with the proper care, you can hang out with us for a much longer time.
Sadly, every once in a while, we have a story, and unfortunately one hit us very close to home recently with Tim Russert passing away at the age of 58
that was tragic.
From heart disease. Has there been an effect in some ways because of that tragedy? Are more and more men starting to think about their hearts and what they need to do at an earlier age?
I just met with some representatives of the American Heart Association and said we should be going red for men who get coronary disease a good 20 years before women. It isn't appropriate to ignore the fact and not to do intensive research, don't you think, on why coronary disease starts so early in young men.
I think 35. In some ways when I've been a proponent, as you know, for women's health for a long time, and we've had this discussion. We almost have created this schism between men's health and women's health, and there's a tendency, I think, to ghettoize either one of them when you do that, instead of talking about gender-specific medicine. Our brains are different, our bones are different, our hearts are different, our risk factors are different. And when you recognize those differences, you can screen appropriately, you can be a better patient and a better doctor, and I think ultimately you level the playing field.
Yeah, well, I think the concentration on women's health, which we've been involved in, both of us, for over a decade, has taught us to look at the unique characteristics of the sexes, which we never did. We kind of used men.
But we have to make sure we don't focus on one at the expense of the other.
Right. Exactly.
And when we call you a knucklehead, it's with great admiration and love.
That means you admire me a
That's
lot.
right.
A lot. Because I hear that term frequently. Doctors, thank you both
You're
very
welcome,
much.
Matt.
And the book, Dr. Marianne Legato's book, you can put a portion of that on our website, so you can check it out there.